This patient has a diagnosis of Down syndrome. Down syndrome is a genetic disorder having some degree of developmental delays. These delays can range in severity from mild to moderate. Some of the underlying areas that are affected in development are poor muscle tone, which is affecting strength and endurance, broad, short hands with relatively short fingers, which decreases coordination for both gross motor and fine motor activities. Also, these patients tend to have decreased sensory processing, which impacts successful participation in all environments. Individuals with the diagnosis of Down syndrome benefit from occupational therapy intervention to promote appropriate sensory, motor, and cognitive activities, with the overall goal to help these children develop motor skills, language skills, social skills, and self-help skills that encourage the highest level of function. The following patient is using the obstacle course in this treatment session to facilitate basic sequencing, direction following, gross motor coordination, and functional strength and endurance. Oftentimes, the obstacle course will incorporate movement such as spinning, as in this treatment, to increase the child's sensory arousal level, which in turn increases the patient's personal motivation to participate. Incorporating more learning type tasks, such as a puzzle or a writing skill, is one way to break up a difficult task with more fun activities, which increases the child's ability to learn new skills. Even though a child may need coaxing, you will notice personal patient satisfaction in the completion of difficult tasks. Using visual stimulating toys such as a spinner are great ways to enhance coordination and strength of thumb muscles. Using fun tongs to pick up small items addresses visual motor integration and hand strength. Functional strength and coordination of thumbs and hands are needed to facilitate participation in fine motor activities such as cutting, writing, dressing, and feeding oneself with a spoon and/or a fork. Use of a puzzle to facilitate visual perceptual skills, visual orientation, in-hand manipulation, and playing at midline are all skills required for coloring and writing tasks. This puzzle is a nice warm-up for visual attention to increase success for the next task. This writing task utilizes tactile cues, such as the raised borders, to increase visual awareness for borders and outlines. And this increases patients' independence for tracing and copying shapes. I want to
bounce on ball. I want bounce on ball.
And then press that.
I want bounce on ball.
Okay, you want to get the ball to bounce on?
Yeah.
Oh, let's get that. It's over here. Delays in language skills can be very frustrating for many of our patients. However, using language strategies such as pictures and communication devices increases patients' social interactions and personal language skills.
I want bounce on ball. I want bounce on ball.
Very good. Okay, get on the ball. Here you go.
Yeah, that's it.
You're welcome.
Thank you.
Yeah, there you go.
That was